And while the pandemic is not over, we have now passed the peak of the Omicron wave, with cases falling, hospitalisations in England now fewer than 10,000 and still falling, and the link between infection and severe disease substantially weakened. We now have sufficient levels of immunity to complete the transition from protecting people with government interventions to relying on vaccines and treatments as our first line of defence. Today's strategy shows how we will structure our approach in England around 4 principles. First, we will remove all remaining domestic restrictions in law. From this Thursday, 24th of February, we will end the legal requirement to self-isolate following a positive test. And so we will also end self-isolation support payments, although COVID provisions for statutory sick pay can still be claimed for a further month. We will end routine contact tracing and no longer ask fully vaccinated close contacts and those under 18 to test daily for 7 days. And we will remove the legal requirement for close contacts who are not fully vaccinated to self-isolate. Until the 1st of April, we will still advise people who test positive to stay at home, but after that, we will encourage people with COVID-19 symptoms to exercise personal responsibility, just as we encourage people who may have flu to be considerate to others. Mr. Speaker, it's only because levels of immunity are so high and deaths are now, if anything, below where you would normally expect for this time of year, that we can lift these restrictions. And it's only because we know Omicron is less severe that testing for Omicron, on the colossal scale we've been doing, is much less important and much less valuable in preventing serious illness. We must now scale this back.
We have no idea whether this is the right time to do it. I have to say, my money would be very much on the side of caution. I know the Prime Minister is making decisions. He's making decisions on the basis of economy. He's making decisions based on more wider political issues. But what I would be very cautious of is rushing into something that we don't have all of the evidence that says that this is not going to backfire horribly.
Yeah, I think we're still gradually learning what they've known in parts of East Asia for a while, is this idea of wearing a mask to help protect the people around, and especially when you're, for example, packed together in the underground in public transport, then it really is sort of the right thing to do, because you don't know if you're infected, to keep people around us safe. So I think when we talk about life getting back to normal, I think we'll just sort of gradually get used to the fact that we probably will want to wear masks. So I think the future where we can bring everyone into living a life with the new normal means we do need to look out for each other more and do things a bit differently than we might have done